Hello, I'm Dr. John Fitz. I'm going to discuss with you in this video interview how glaucoma surgery works, how we treat glaucoma in general, and when medications fail, how we resort to a new technique to help you to maintain a good pressure and to preserve your vision. In glaucoma, the eye pressure gets too high. The eye is like a sink. You've got a faucet going in and a drain going out. And this drainage system is right in here at the junction between the window in the eye, the cornea, and the iris, the colored part of the eye, which forms an angle. Water is produced back here in the ciliary body, goes in front of the lens, through the pupil, and out through this drainage system. And in glaucoma, the drainage system doesn't work very well. It's plugged up. And so the medicines, the eye drops we give you, lower that pressure by allowing more fluid to go out through the drainage system, or they decrease the amount of fluid that's produced. In either case, lowering the pressure helps protect the nerve that goes from the eye to the brain, the optic nerve, which gets damaged in glaucoma. Over time, the nerve dies off. And our goal is to prevent that optic nerve from dying. To make sure that your eye health is good, we need to preserve this optic nerve to carry information from the eyeball back to the brain. And if this nerve is gone, we have no way to recover it. So like most things in life, our job is to prevent this damage from occurring too far to allow your vision to function normally. In glaucoma surgery, we're not able to lower the pressure enough with medications to achieve the goal that we want, which is to preserve this optic nerve. And so what we do is create an alternative drainage system. What we do is we make an incision in the eye. It's like a trap door, with the base of the trap door right here at the junction between the cornea and the white part of the eye that we call the sclera. And what we do is we peel the skin of the eye back. We then put this trap door in, and we create an opening underneath the bottom of the trap door. Water then flows through the opening, out the trap door, through the edges of the trap door. Then the skin that covers the eye absorbs the water coming out. So what we're doing, in effect, is creating a new drainage system, bypassing the one that's blocked. Now, this is sort of like Goldilocks and the three bears. Mama bear, Papa bear, and baby bear. And we want mama bear pressure. We don't want it too high. We don't want it too low. So we use stitches that can be removed or can be cut with a laser to keep the trapdoor sealed. The first few days after surgery, we don't want the pressure too low. Then as the eye recovers, the pressure starts to come up, and we don't want it too high. We want it right where we want it. And usually that's pressure somewhere in the 10 to 15 range. Depending upon your optic nerve health, we may accept a higher or we may desire a lower pressure depending upon your individual situation. These take several weeks, if not months, to heal. And for the first 2 weeks or so, you need to wear a shield over your eye to protect it, and you really can't do any heavy lifting or straining. Anything that involves kind of activity, you need to avoid. So you need to sleep on your back, on your other side. You don't want to poke on the eye real hard, and you want to use the drops we ask you to use. At first, the vision tends to be quite blurry. Sometimes so blurry you can't see even the big E on the reading chart. But over time, this improves. And visually, you're noticing improvement usually after the first week or two, and after 2 months or so, you may need a change in your glasses to get your best vision. If the surgery doesn't work, if the pressures are too high, then sometimes we have to repeat it. And on occasion, we'll put a plastic tube made out of silicone in the drainage system to keep it open. These are called glaucoma tube shunts. And they're used as sort of a last resort if traditional glaucoma surgery can't work. Sometimes we add a medication called mitomycin C to the surface of the eye, underneath the skin of the eye, that prevents healing. And this will sometimes result in the pressure being too low, in which case we have to sort of undo what we did a little bit. But in most patients, it allows the pressure to be more reliably low in this range that we desire. So particularly if you've had risk factors for failure of these glaucoma surgeries, such as if you're young, if you've had previous eye surgery, if your pressures need to be really low, then we use mitomycin C as a part of the procedure to help with getting the results that we want. Now, after the procedure, we'll get about 90% of people with significantly lower pressures. In some cases, they need no medications at all to lower the pressures. In some cases, they may need a drop or two to keep the pressure where we want it. But still, at least it's in control compared to what happened before the surgery. Now, it's very common for the lens inside the eye to turn cloudy. We call that a cataract. And if you have a cataract prior to the surgery, a lot of times we'll remove the cataract at the same time we do the glaucoma procedure. And if that's the case, we'll show you a second movie that talks about cataract surgery and how that works. If you don't have much of a cataract, about 2/3 of people would get a significant cataract within a year or two after the original procedure. So you can almost bet that cataract surgery will be needed at some point. But that cataract surgery is no higher risk than anybody else if you do the technique properly in relationship to how your glaucoma surgery was done. Afterwards, your eye is a little red and watery and scratchy. It's irritated a little bit, and it's sensitive to bright lights. But all these symptoms improve as time goes on. Now, typically, this surgery doesn't take very long, usually about 45 minutes in the operating room. Usually there is an outpatient in the outpatient surgery area for 3 hours or so. And you'll need someone to drive you until your vision's recovered to the point where you can drive safely. Serious complications can occur with this procedure. The most serious probably is what's called a choroidal hemorrhage. That's where the blood vessel layer under the retina breaks. Usually this occurs when people are too active afterwards. That's why we want you to have a low activity level. And if that happens, you get a big blood clot under the retina that commonly causes permanent and severe vision loss that we really can't recover. Symptoms of this would be very quick, significant vision loss, often associated with a lot of pain. So you usually know something bad's going on. Unfortunately, once this occurs, it can be very difficult to fix. 1 in 1,000 people can get an infection at the time of surgery, where bacteria grow inside the eye, and that causes a change in vision for the worse. So if you notice increasing pain or decreasing vision, we need to know about that right away. When you do these glaucoma procedures, you leave a little drainage system under the skin of the eye that forms a bubble on the surface of the eye. We call that a bleb. And if you get pink eye, conjunctivitis, in a normal eye that won't cause any permanent visual problems. But in an eye that's had glaucoma surgery, the bacteria can go through the glaucoma surgery site into the eye itself and can potentially be vision threatening. And so, if you get pink eye months or even years after this procedure, we need to treat it aggressively with antibiotics. It's something that wants to be seen right away for. Don't wait until it, quote, gets better, because it may well get worse rather rapidly and can cause permanent problems that you don't want to have. And so, you need to be aware of this lifetime risk and treat pink eye conjunctivitis aggressively with antibiotics if this occurs. Occasionally, the glaucoma surgery site will develop a leak after the surgery, and sometimes we have to revise the surgery by pulling healthy skin over the area where it's leaking to stop the leak. And other things can happen I haven't even talked about, but in truth, this is fairly successful, it's fairly low risk, and if we feel that the risk of the blindness from glaucoma, as it's being currently treated, is higher than the risk of the surgery, then we recommend the surgery be done. If you have any further questions, feel free to ask members of my staff or myself, and I'd be happy to answer them for you. Thank you very much for your attention.